Hey everyone out there, it's Roberto Miki again, and we're going to be talking about finger flexor tendons today, and we're going to be discussing the anatomy and the physical examination findings. A bit of a disclaimer, this video is not to be used for medical decisions. It is really meant for patients, medical students, residents, and fellows who are interested in learning a little bit more about the anatomy of the hand. So everyone, this is a drawing of a finger, and it's from the palm side of the finger or volar side of the finger. The top of the image is the distal edge, and the bottom of the image is the proximal edge of the finger. And just as a reminder, distal means towards the tip, and proximal means towards the body. So next we have a drawing of the bones within the finger. The bone towards the tip of the finger is called the distal phalanx. The bone in the middle portion of the finger is called the middle phalanx, and the bone that's found on the proximal edge of the finger is called the proximal phalanx. Interestingly, if you're ever drawing a finger, there's a ratio of the phalanx bones. The distal phalanx, if it's a unit of 1, then the middle phalanx is a unit of 2, and the proximal phalanx is a unit of 3. So the next structure we need to know is the distal interphalangeal joint, which is the joint between the distal phalanx and the middle phalanx. The next joint we need to know is the proximal interphalangeal joint, which is the joint between the middle phalanx and the proximal phalanx. The last joint we need to know is the metacarpophalangeal joint, which is only half drawn here, but it connects the metacarpal to the proximal phalanx. So getting to the main subject of this talk, the two flexor tendons that are in the finger are the flexor digitorum profundus and the flexor digitorum superficialis. The flexor digitorum profundus is depicted in this drawing in red. One thing that's very important to know is that the FDP has a split innervation. The index and long finger FDP tendons are innervated by the median nerve branch called the anterior interosseous nerve, and the ring finger and small finger are innervated by the ulnar nerve. The flexor digitorum profundus tendon originates in the forearm and then inserts in the distal phalanx. And so it does flex 3 joints in the finger: the distal interphalangeal joint, the proximal interphalangeal joint, and the metacarpophalangeal joint. The flexor digitorum superficialis tendon is the other flexor tendon in the finger, and it is depicted in purple here. Just like the flexor digitorum profundus, there are 4 flexor digitorum superficialis tendons, and they are innervated by the median nerve alone. So unlike the flexor digitorum profundus, there is no dual innervation. Flexor digitorum superficialis, like the flexor digitorum profundus, starts in the forearm, and then, unlike the flexor digitorum profundus, it inserts into the middle phalanx. Due to the difference in the insertion, the flexor digitorum superficialis only flexes the metacarpophalangeal joint and the proximal interphalangeal joint. The name superficialis in the finger is a little bit of a misnomer because in the finger, the flexor digitorum superficialis is actually sitting deep to the flexor digitorum profundus. And this is because the tendons switch position in the finger. In the forearm and in most of the hand, the flexor digitorum superficialis is sitting superficial to the flexor digitorum profundus. But at Camper's chiasma, the flexor digitorum superficialis splits and then reforms deep to the flexor digitorum profundus tendon. This is depicted where the red arrow is found here in this drawing. Here is a diagram of both tendons together, and there is an intricate set of pulleys that holds these tendons down against the bone. These pulleys come in 2 forms: annular and cruciate pulleys. The first pulley is an annular pulley, and it's called the A1 pulley, and it's depicted by this green little structure. It is found over the metacarpophalangeal joint. The second pulley and the second annular pulley is the A2 pulley, and it is depicted by this lighter green structure. And at a later time, we'll discuss why we made it a slightly different color because of its importance. The A2 pulley is found over the proximal phalanx. The third annular pulley is the A3 pulley, and it is depicted by this darker green structure over the proximal interphalangeal joint. The fourth annular pulley is called the A4 pulley, and it is found over the middle phalanx. It is also depicted by a lighter green structure because of its importance, and we'll detail that later. The last annular pulley is the A5 pulley, and it is found over the distal interphalangeal joint. The cruciate pulleys are going to be depicted in orange, and this is the first one, the C1 pulley, and it is found between the A2 pulley and the A3 pulley. The next one is the C2 pulley, which is found between the A3 pulley and the A4 pulley. The last of the cruciate pulleys is the C3 pulley, and it is found between the A4 and A5 pulleys. So here's a depiction of all the pulleys put together. Not all of the pulleys are that important. In fact, only the A2 and A4 pulleys are important structurally. In fact, the other pulleys can be sacrificed and you will not develop something called bowstringing. However, if the A2 or A4 pulleys are damaged, you can develop bowstringing, which is where the tendon pulls away from the bone, and this leads to limited range of motion and strength in that finger. Here's the drawing of the flexor tendons with all of the important structures labeled. I would recommend copying this drawing over and over again until you can reproduce it without error. So flexor tendons can be injured, and we typically classify the injuries based on the zone of injury. We're not going to go into full detail about the zones of injury, but the zones of injury are important because they help us predict how the finger is going to do and also the appropriate treatment. The zones of injury give us an example of why it's important to know the anatomy well. Zone 1 is defined as any injury that's distal to the FDS insertion. Zone 2 is defined as the area between the A1 pulley and the insertion of the FDS tendon. Historically, repairing tendons in Zone 2 or no man's land is very difficult. In Zone 2, there are two problems that are making the repair difficult. One, there are two tendons, the FDS and FDP tendon, and there's this pulley system to deal with. So in this portion of the video, we're going to demonstrate some of the physical examination tests that you can perform to test the function of the FDP tendon and FDS tendon. In this video, we are showing how to test the flexor digitorum profundus tendon. And basically, we're taking our finger and we're blocking the middle phalanx, allowing flexion of the DIP joint. And we ask the patient to flex the DIP joint, and if they can flex it, then you know the FDP tendon is intact. So in this video, we're showing how to test the FDS tendon. And we do this by blocking the FDP tendons of the other fingers by grabbing the distal phalanx and not allowing it to flex. This causes the FDS tendon to only be able to flex. Now we're repeating this part of the video because this patient has an independent FDS tendon to the small finger. Now in this hand, which is my hand, I do not have an independent FDS tendon to the small finger. In fact, I can only flex my FDS tendon to my small finger if I leave my ring finger free. About 10 to 20% of the population will not have an independent FDS tendon to the small finger. So when you're examining patients for lacerations, you have to take this into account. Well, everyone out there, I hope you enjoyed the video, and please hit like and subscribe so we can keep making these videos.